Okay, desynchrony, and basically that means that there is mismatch or no synchronization between the patients and the ventilator. What does it mean? Let's see, here's a patient and here's the ventilator. And this is the green is, as we always say, this is the inspiration, and this is the yellow, the expiration. So basically, for ideal situation, and that's what we would like the patient to have, when the patient initiates the breath, that will trigger the ventilator, and so the ventilator will help the patient get the breath, as we explained. And then we want both the patient and ventilator to terminate the breath at the same time and go to the baseline phase or expiration phase at the same time, and then wait for the next trigger, and the cycle repeat itself. But what if the patient trying to trigger the ventilator, but the ventilator is not listening? So the patient trying to breathe, but the ventilator not delivering the breath. So that's one scenario. The second scenario, what if the patient is not trying to breathe and the ventilator receive a false trigger and go and deliver the breath? So that's another scenario. Also, maybe while the ventilator is delivering the breath, the patient trying to take another breath. And during inspiration, the ventilator doesn't listen to any triggers. So that's another problem. The patient may be trying to breathe while the ventilator still has not finished delivering the breath. So that's another problem. Or another problem, that the patient finished his inspiration and wants to go to expiration or baseline phase while the ventilator is still in the inspiration phase. Or the opposite, the patient may be still in the inspiration and the ventilator terminates the breath and goes to the baseline expiration phase. All these possible problems can happen, and this is what we call desynchronization or mismatch. And this, sometimes we call it fighting. The patient is fighting the vent. It's very important to recognize it and treat it, because simply this will lead to increased work of breathing. So for the patient, instead of for the ventilator instead of helping the patient, make things worse. And in a critically ill patients, we need every single piece of energy, and that's why we use the ventilator, right? This will lead to worsen gas exchange, also may affect the hemodynamic stability for our patients. So may worsen gas exchange, increase work of breathing, and hemodynamic instability. And remember, this desynchronization problem or mismatch or fighting happens only if patient still able to trigger a breath. So patients who cannot initiate a breath and getting only backup rate will not have any problem with desynchronization, like brain dead patients or severe brain injury or deep sedation or paralyzed patients. All these patients are dependent on the ventilator and the backup rate, because only ventilator breath delivered, we will not have any desynchronization. The desynchronization will happen only with patients who are triggering their own breath.